So, the first thing for an SLP to do for a bedside swallow evaluation is review the patient's chart. In the chart, we want to look for the following: medical problems such as stroke and laryngectomy, medications, especially those that may cause dry mouth or someone to be lethargic, history of swallowing disorders, airway devices, oral and non-oral nutrition, and puree food. Next, to go more in depth about looking into the history of the patient's swallowing disorder, we can review the chart, but also ask some questions during the initial meeting if we see a history of a swallowing disorder documented in their chart. We should ask the following. We should ask when the disorder began. Did it worsen gradually or rapidly? How does the problem vary with different consistencies? What specifically happens when the patient tries to swallow? Does material stop somewhere along the way, and if so, where? Ask the patient to point to the spot where he feels that the material collects. And lastly, we should observe if the patient coughs or chokes, and if so, when, before, during, or after the swallow. Next, we want to look into the presence, type, and duration of airway tubes. If the patient has a trach tube, we need to look into the presence of cuff, status of cuff, the size of the tube, and presence of fenestration. Next, we want to know the length of time the trach tube has been in place. So in order to do a swallow evaluation with a cuff trach patient, we must deflate the cuff and lightly cover the end of the tube during the swallow and for several seconds after the swallow, such as using a one-way valve. For a patient on a ventilator, we would deflate the cuff of the tracheostomy tube. We would present the food at the beginning of the exhalation phase. For a patient who is intubated, we would not be able to do a bedside swallow evaluation. Next, we consider a patient's diet. We need to know if they are on a specific diet, such as mechanical soft foods or thickened liquids. In addition, there may be patients who require non-oral feeding. We want to note the type, which may include NG tube, PEG, or PEJ. After chart review, we want to meet the patient, and our observation begins the moment that we walk into the room. Hi, my name's Lexi. I'm the speech therapist, and I'm going to be doing some observation as well as looking at some of your facial structures and mouth structures in order to perform a swallowing evaluation. Do you have any questions for me?
No, I do not have any questions.
So for the next part, we are going to observe the patient's posture in bed, as well as their alertness, their handling of secretion, their level of secretion, respiratory status, behavior, cognitive status, and language abilities. For behavior, we note if the patient is agitated or lethargic, and if they're lethargic, we cannot do a bedside swallow evaluation. For cognition, we know orientation to person, place, and time. And lastly, for language, we can observe their ability to follow directions. Okay, so to begin, I'm just going to start with some few questions. So can you tell me your first and last name?
My name is Ali Runish.
And what day is it today?
Today is March 7th, 2025.
And can you tell me where we are?
We are in a house.
Awesome. Okay, next I'm just going to ask you to follow some simple directions. Can you point to your nose for me? Can you close your eyes? Can you open your eyes? And can you open your mouth wide for me? Awesome. Thank you. All right, so after we have done the chart review and asked some questions, we move on to the facial, oral, and palatal anatomy. We will look at the following structures and note any scarring and or asymmetries. So the first few things we're going to look at include lip configuration, the hard palate configuration, the soft palate and uvula dimensions relative to the distance of the posterior pharyngeal wall, faucial arches, lingual configuration, adequacy of sulci at the sides and front of mandible, dentition and secretion, and lastly, the floor of the mouth. Alright, so the first thing we're going to do is I just want to take a look at some of your oral structures and some of the structures in your mouth, okay? Alright, so I'm just going to use my flashlight. Turn that on, and then I have a tongue depressor too. It does kind of taste like strawberries.
Good to know.
Oops, that didn't open. Fantastic. Alright. Alright, let's take a look. Can you lift your tongue up for me? Perfect. Put it back down. Great. Thank you. Okay, so next I'm going to be looking at some of the structures and functions of your lips. So the first thing I'd like you to do is go E.
E.
Perfect. Next I want you to go ooh, ooh. Okay, now after that I want you to alternate between E, ooh, E, ooh.
E, ooh, E, ooh, E, ooh, E.
Perfect.
Ooh.
Thank you. Okay, now I'm going to have you go pa, 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 10 times.
Okay. Pop, 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 pop.
Perfect. All right, now I'm going to have you close your mouth tightly and do a swallow for me. Perfect. All right, now I'm going to have you repeat this sentence. Peter Piper picked the bags.
Peter Piper picked big bags.
Perfect. All right, and then the last thing I want you to do for me is I am going to put this on in between your lips and I'm going to pull and I don't want you to let me, okay?
Okay.
Perfect. Now I'm going to do this side. Close. Okay, now this side. Perfect. Thank you. All right, so next I'm going to look at your tongue. So what I want you to do is I want you to push it out as far as you can as well as pull it back as far as you can.
Okay.
One more time. Perfect. All right, the next thing I want you to do is I want you to touch your tongue to each side like this. A couple more times. Perfect. Thank you. Okay, the next thing I want you to place your tongue at the tip of your mouth. Perfect. Now I want you to drop it. And I want you to do that a couple of times for me. Perfect. Okay, now I want you to say ta 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 ta.
Ta 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 ta.
Perfect. Now I want you to repeat this sentence. Take Tim to the table.
Take Tim to the table.
Perfect. All right, now I want you to place your tongue on the roof of your mouth and slide it backwards. Perfect. All right, now I want you to say Perfect. Now I want you to repeat this sentence. Kate can't keep candy.
Kate can't keep candy.
Perfect. All right, now the last thing I want you to do is I am going to take this tongue depressor. I'm going to put it out. I want you to push against it. I'm going to do forward and then off to the sides.
Okay.
All right, go ahead. Push. Great. All right, this way. Okay, push. Perfect. I would assess the patient's chewing by dipping a gauze pad in a pleasant tasting liquid. I would remove the excess liquid and then I would ask the patient to move the gauze laterally onto the teeth, chew on it, then move it to the other side. All right, so the next thing I will do is assess the patient's soft palate as well as their pharyngeal wall. So would you please do ah for as long as you can? Thank you. Okay, now I'm gonna have you do ah 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 ah
Ah, 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 ah.
Perfect. Now, if you could open your mouth, I'm just gonna put this in there. Perfect. All right. So now I'm gonna look at some of your oral sensitivity. Okay. So I'm gonna still place this tongue depressor, but at different points in your mouth, and just see where it is the most sensitive. Okay. Perfect. Thank you. And now I'm gonna have you do one more. I'm gonna look at some of your laryngeal function. So do ha. Perfect. All right, now I'm going to have you cough for me. Okay. Now I'm going to have you do a vocal scale. So you're going to go, Perfect. And then I'm going to have you take a breath and produce as long as you can.
Okay.
Perfect. All right, so after we perform the oral mech, we should make a decision regarding regarding doing the trial swallow. So a trial swallow should not be conducted if the patient is ill, has significant pulmonary complication, weak voluntary cough, over 80 years old, cannot follow directions, and or suspect having pharyngeal swallowing disorder. If we decide that we can do the swallow trial, then we want to suction the patient orally to clean for bacteria. All right, so the next thing we're going to do is we're going to start the swallowing trial. So I have here some water, I have some, a banana that's mashed, and then I also have a cookie. So what I'm going to do is I'm going to give you the water. You're going to hold the water in your mouth until I tell you to swallow. After you swallow, I'm going to have you go ah, then I'm going to have you pant. After you pant, I'm going to have you do the ah again. Then I'm going to have you turn your head to each side and say ah. And then after, I'm going to have lift up your chin and do the ah again. Okay? And we're going to repeat that for each one with the cookie, the banana, and the water.
Got it.
All right, so let's start with the water. Remember, do not swallow until I say to go.
Okay.
Okay, go ahead. All right, now I would like you to do ah.
Ah.
Okay, pant. Okay, ah.
Ah.
All right, now I want you to turn your head to each side and do ah.
Ah.
Other side.
Ah.
Perfect. Now I'm going to lift your chin up and have you do ah.
Ah.
Perfect. All right, so we're going to do the water one more time. I'm going to have you take a sip for me. All right, remember, don't, not yet. All right, go. All right, now say ah.
Ah.
Pant. Say ah.
Ah.
Turn your head to the side.
Ah.
Other side.
Ah.
Perfect. Now I'm going to lift your chin up. Perfect. All right, now we're going to do the banana. We'll do it twice again. Okay, swallow. All right, do ah.
Ah.
All right, now I'm going to have you pant. All right, now I'm going to have you do ah.
Ah.
Turn your head to the side. Ah.
Ah.
Turn your head to the other side.
Ah.
Perfect. Now I'm going to lift your chin up.
Ah.
Perfect. All right, we're going to do it one more time with the banana. All right, go ahead. Perfect. Okay. Ah.
Ah.
All right, pant. All right, do ah again.
Ah.
Turn your head to the side.
Ah.
Turn your head to the other side.
Ah.
All right, and now I'm going to put your chin up and do ah.
Ah.
Perfect. All right, now we're going to move on to the cookie. All right, I'm going to have you take a bite of it and wait to swallow. All right, swallow. All right, now I'm going to have you say ah.
Ah.
I'm going to have you pant. I'm going to have you say ah.
Ah.
I'm going to have you turn your head to the side and say ah.
Ah.
I'm going to have you turn your other side.
Ah.
Okay, now I'm going to lift your head up, say ah.
Ah.
Perfect. And then we are going to do our last one with our cookie. Swallow. All right. Now I want you to say ah for me.
Ah.
Pant. All right, say ah.
Ah.
Turn your head to that side. Ah.
Ah.
Turn your head to the other side.
Ah.
Now I'm going to have you lift up.
Ah.
Perfect. Thank you. Okay, so based on our evaluation, I think that today we do not need to do further instrumentation, and I do recommend a regular solid diet with regular liquid. I think we're good.
Awesome. Thank you.